Hey guys, today we're going to be learning about the cranial nerves in a cool way you can remember them. So there are 12 cranial nerves, and a mnemonic device you can use to remember them is O, to touch and feel, very good velvet, ah, heavens. So now you're going to learn what those nerves actually are rather than just velvet. So first you're going to draw a nose, because everyone has a nose. Olfactory. That controls your senses and your smell. And a way you can test this out if someone has a nerve deficit is to just put mustard up there, not up there, to hold mustard out and see if they can smell it. Just to hold something to see if they can smell it. And then you're gonna draw two eyes. 1, 2, because you have two eyes. And then in the middle, you're gonna draw some pupils as number 2. Number 2, number 2. And that's your optic nerve. And that controls your vision and you're able to see. Yeah. And to test that out on the field, you can either use a Snellen chart, but you don't have a Snellen chart on the field, so you can tell them to read the scoreboard or put something up on your phone and tell them to read it. And then you're going to draw some eyebrows because you have eyes and nose. And your eyebrows are going to be number 3. Your eyebrows, oculomotor, because they control eye movement, and pupil constriction and dilation. And so because when you open and close your eyes, your pupils let in light and it constricts your pupils. And so to test this out, you can do pearl. And now you're going to do 4, which I'm going to make the pen smaller because, yeah. Okay, 4, which is right there. In the corner of your eye, trigeminal, it controls looking down and in. So to test that, you're just going to do eye motility and stuff like that. And then you're going to do 5, so I'm going to make the pen bigger again. And that is trigeminal. 4 is not trigeminal. I think I called it trigeminal. It's trochlear, by the way. 4 is not trigeminal. 5 is trigeminal. So 5 is trigeminal. It controls mastication and chewing. So just tell them to chew. And then 6 is abducens, because you're abducting your eye. So you're going to add it to your eye. And it's looking out, your peripheral vision. So again, eye motility. So you're going to test by doing eye motility or VOMs or whatever. And then number 7 is facial, because you have all these facial features but no face. So let's draw a face. It's your facial feelings, facial senses, and stuff like that. So that's that. And then now you have an entire face, no mouth, obviously, no ears. What's 8? Vestibulocochlear. Let's draw some 8s for ears. Controls your hearing and balance. Wonderful. And then now, let's draw a tongue.
Wait, how do you test that?
Oh, you test that by letting them balance or speaking to them. Can you hear what I'm saying? Stuff like that. And then now we have an entire face, even a mouth, but what about your tongue? Let's draw your tongue. So now you have 9, which is glossopharyngeal. And for glossopharyngeal, it's controlling swallowing and stuff like that, and taste and stuff like that. So to do that, just give them some mustard. You can test it by seeing if they can swallow or seeing if they can taste. And then you have 10. You have an entire face but no body. Let's draw your body. 10. It's your vagus nerve. It controls your internal organs, your heart rate, your gag reflex, stuff like that. So everything internal rather than what the other nerves are controlling, movement or vision or stuff like that. This is stuff that you can't really control because you can't control your own heart rate. And so to test that out, you do put a popsicle stick in their mouth or something like that, because it's also their gag reflex, so stuff like that. And now you have your body, your face. Let's draw some arms for number 11. That's your accessory nerve, because your arms are sort of an accessory. It controls shoulder shrugging, so make your patient shoulder shrug if you have to test that out. And now for last, the only spot you haven't filled in on this entire board is the lower part of your tongue. That is 12. Hypoglossal. It controls tongue movement and sticking your tongue in and out of your mouth, which is why the tongue is outside of its mouth. So to test that out, you would stick their tongue in and out of you would ask their patient to stick their tongue out of their mouth. Thank you, that's it. So again, all the nerves, it goes olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. Hope you learned something new.
Slay.